Prabha. Digital India. Educated India.
Welcome to the course Nutrition for the Family. This is the fifth module, that is Nutritional Care for the Elderly. And this is the second lecture of fifth module in which we shall be studying about nutritional requirement of elderly. I am Dr. Jaspreet Kaur, presently working as Associate Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayamprabha, MHRD, New Delhi. In the first lecture of this module, we had studied about the aging process, in which we studied about the free radical theory of aging, and after that we studied the changes associated with the aging, that is what are the physiological changes, what are the physical changes and the psychological changes, and their effect on the nutritional intake and nutritional status of the elderly. And in this lecture, we shall be focusing on the nutritional needs of the elderly, and we will study about the recommendation about the various nutrients, that is macronutrients, micronutrients, water and antioxidants. So let's start. General nutritional recommendations, they are more or less similar to the adult population with little modifications, of course, but some of the elderly, they have special requirements because of age related physical and physiological changes, because there is lot of variation regarding these changes in the elderlies. Let's talk about energy requirements first. As we know, with the elderly population, there are so many changes which occur, which include body composition and other activities. And age-related changes, they include a reduction in the muscle tissue and muscle strength. And along with, there are corresponding changes in the body composition, which increases the visceral fat. Now, visceral fat is the fat which surrounds the internal organs, and this visceral fat affects the functioning of the various organs. And body protein level in the healthy elderly is around 30 to 40% less than that of younger adult. And if we talk about fat percentage, in say in males, it increases from about 15% to 25% as the age advances. And so if the fat percentage was 15% when the same man was say 25 years old, now once he becomes 60, it could go as high as 25%. As a result, due to reduced muscle mass and other metabolically active tissue mass, the BMR, basal metabolic rate, it starts falling after the 35 years of age. Now, BMR is your energy which is used to carry out the involuntary activities of our body. These are the involuntary activities which are not under our control, and this is a running cost of our body. For example, our lungs are working, our heart is working, our gut is working, digestion process is going on through gut and similar activities. So this starts following after 35 years of age. This will affect the energy requirements of the elderly. And along with that, there is reduction in the physical activity also. This will also affect the energy needs of elderly. Therefore, reduction in lean body mass, that is the muscle mass, and increase in the adipose tissue and thirdly, decrease in the physical activity. These three components, they will collectively reduce the resting metabolic rate by around 15 to 20%. So how are we going to calculate the energy requirements? We calculate the energy requirement by multiplying basal metabolic rate along with the physical activity level values. We have divided the lifestyle into three categories. Uh, as we have already studied about the adult energy requirements. So same is the case here also. So the physical activity level can be sedentary, moderate or heavy. So the associated figure with the sedentary activity is 1.40, and for the moderate it is 1.80, and for heavy worker it is 2.30. What we will do, if we are going to calculate the energy requirements for a sedentary worker, so we will first see what is the BMR level and we will multiply it with 1.40 to estimate the energy requirements. When we talk about elderly, for each year above 30 years, it is a thumb rule to subtract 10 calories per year for men and 7 calories per year for women. So if we, for the ease of remembrance, for per decade, 100 kilocalories reduction is required for men and around 70 kilocalorie reduction is required for the women. That is after 30 years of their age. This is the estimated energy requirements table given by ICMR RDA 2020. As we can see in this table, the first column is gender, male and females, and after that we have body weight. As we know, the reference body weight of man is 65 kgs and of a woman is 55 kgs, and after that these are the age segments, that is 19 to 30 years, then 30 to 60 years, and after 60 years that is elderly. As we can see, the first column in each segment is based on the basal metabolic rate given against the body weight and in the age segment. So after that, what we see is the physical activity level, that is sedentary activity, moderate activity, heavy activity, and this indicates the energy needed for each kind of physical activity based on basal metabolic rate and physical activity level. And if we see, if we compare the basal metabolic rate of elderly who is 65 years of age, as we can see and we can compare. So once the man or the male is between 19 to 30 years, his BMR is 1506, and when this person is around 30 years of age, his BMR falls to 1458, and see the reduction once he is 60 years old, more than 60 years, his BMR falls further, that is 1213. That is why the based on the same kind of physical activity, the recommended energy in intake or the requirement should be 2109 once he was following in 19 to 30 years category, and after that 2000 if he was following in 30 to 60 year category, and same is reduced to 1699, that is closer to 1700 once he is 60 years plus. And same is the case with the females. As we can compare, these are the similar findings that BMR goes down, so that is why the energy recommendations say that the energy needs, they are also lowered as the age is advancing. Let's focus on protein now. As the people age, there is decrease in the skeletal tissue mass also. So this results in decrease in the reserve or the store of protein which is provided by the skeletal muscle, and This may be inadequate to meet the needs of the protein synthesis, which should go on constantly inside the body. So the protein requirements, they are not changed during old age also. It is same as of younger adults, that is 0.8 gram per kilogram of body weight. Since the calories are reduced without decreasing the protein, diet should be rich in protein as compared to the normal adult diet. But because of decreased appetite, poor digestion, older people, they are likely to consume low amount of protein. So its deficiency, it can lead to edema, anemia can occur, or there could be lower resistance to the infections. Therefore, under the condition like whenever there is a stress, internal or external stress, or there is trauma, or any infection is there, or surgery is happening, or fracture, or unusual protein losses are going through the kidneys, the requirement of protein is increased. So the protein energy ratio in the diet, it should be increased, because we have seen in the energy requirements that the elderly, they need lower amount of energy. But to maintain the good level of protein, the protein to energy ratio has to improve. That means the contribution of protein towards the total energy consumption has to be increased. So this can be taken care of with the help of including animal protein like lean meat, poultry, fish, eggs, or dairy products. They are good sources of protein. And similarly, if the person is a vegetarian, he can consume good amount of milk, and along with that he can take a good proportion of legumes and nuts to include good quality protein in their diet. As the carbohydrates, they are the major contributors of energy in our diet, the calorie requirement has reduced, so the carbohydrate content should also be reduced proportionately. And for carbohydrates, it is suggested that whole grains, cereals, and pulses, they should be included in the diet. Ideally, the 55 to 60% of calories, they should come from carbohydrates. So it is necessary that at least 50% of the calories, they are derived from the carbohydrates. Diet should also include both simple and complex carbohydrates. The complex carbohydrates contain more fiber, vitamins, and minerals, and they are digested slowly and they reduce the glycemic response. And now, this glycemic response is very, very important for the elderly who might be having some insulin resistance, or having some uh, diabetes or similar issues related to carbohydrate metabolism. Fats are essential nutrients to meet the energy requirements, to meet the essential fatty acid requirements, and getting good amount of fat soluble vitamins. The fat requirements, they are also reduced corresponding to the energy requirements. So the dietary fat, they should be meeting around 30 to 40% of the total energy intake. And when we are talking about the quality of the fats, which is as important as the quantity of the fat, saturated fatty acid, they should be taken in moderation, and maximum 10% of calories, they should come from saturated fatty acid. And the intake of the saturated fatty acid should be substituted with the unsaturated fatty acids, which are containing high amount of omega-6 or omega-3 ratio. And many studies, they have found that the elderly who are taking high amount of omega-3 fatty acids, they are having a better vision also. And omega-3 fatty acids, they help in certain conditions such as hair loss or impairment of vision, improper digestion and gas problem, and poor kidney function, tissue inflammation, osteoarthritis, painful joints and muscles, and mental depression. So omega-3 fatty acids, therefore, which is coming not from the visible fat, but from the food items, they are considered good for elderlies. Now let us talk about micronutrient needs of the elderlies and start with the requirements of various minerals. Calcium is very important for the elderly, and it is associated with formation and normal metabolism of bones inside our body. And 99% of calcium, it is present in the bone and teeth. That is the hard part of our body. And rest 1%, it is critical for mediating contraction and dilation of our blood vessels, that is our arteries and veins. And it is needed for the muscle function, for the nerve transmission, and for the hormone secretion also. And its deficiency, it causes development of osteopenia, that is the starting of bone disease, and followed by osteoporosis, and it can also lead to fractures. Dietary intake of calcium, it is low among the elderlies in our country. Now there are certain reasons behind this low dietary intake. So the first reason is people, they are not taking adequate amount of calcium in their diet, and along with there are certain factors where the absorption of calcium from the food, that is diminished. So for example, because of estrogen deficiency uh, in the females, or because of prolonged immobilization where the person is having maybe fracture or any disease where he cannot move around, or there is some endocrine disorder because of hormonal imbalance, or low physical activity because of joint pains or some other problems if the person is sedentary, or because of certain drugs. So all these reasons, they contribute towards less availability of calcium to the body. And secondly, the age-related bone loss also contributes towards this problem. What happens when the bone remineralization process is less than demineralization? That means the calcium is going away from the bones, it is leaching from the bones, but the remineralization process, that is slowed down. So this will cause weakening of the bones, less calcium available in the bones, porous bones, they will happen, and this compounds the problem. And along with that, there is reduced glomerulofiltration rate of the kidneys also, and this will affect the renal conversion of calcium. So these kidneys, they were reabsorbing the calcium, and they were managing the calcium metabolism. So here, because of reduced glomerulofiltration rate, this will lead to secondary hyperparathyroidism. So hyperparathyroidism, this will cause significant bone loss away from the body, and this will further complicate the deficiency of calcium. So calcium needs, they increase during old age because of increasing mobilization of calcium from the bones and higher incidence of osteoporosis. So during old age, the estimated average requirement of calcium is 1 gram, that is 1000 milligrams, and RDA of 1200 milligrams, that is recommended daily. And why this recommendation is higher than normal adults? That is because of certain reasons. First, as we have studied in the previous slide also, there is limited availability of calcium from foods. Secondly, to compensate the age-related bone loss, to improve the calcium balance inside an elderly's body, and to prevent the fractures and the tooth decay, and Lastly, to compensate the decreased efficiency in the calcium absorption, which is happening because of various reasons. The aging does not affect the iron needs. Therefore, the iron needs, they are considered same as that of their younger adults. But the mild anemia, it may affect the health of the older people due to inefficient circulation of the blood and related outcomes. So therefore, the iron intake should be adequate during the old age also. Keeping in view the absence of the menstruation, the requirements, they are kept same for men and women. So an EAR of 11 milligrams and an RDA of 19 milligrams, it is considered sufficient for elderlies. If we talk about sodium, there is no scientific evidence that suggests that moderate sodium restriction, it will delay or prevent the onset of cardiovascular diseases among elderlies. It is believed that the greater restriction of sodium, it should not be attempted except under the advice of the physician whenever the person is hypertensive or he's having some cardiovascular problems. So under these conditions, we have to go for some kind of restriction. In fact, the moderate amount of salt, it will help in improving the palatability of the diet. And so the acceptability of the diet will be more if the person is taking adequate amount of sodium in the diet. So the sodium requirements, they are same as for a healthy elderly, just like for a normal adult. That is around 1 teaspoon of salt, around 2300 milligrams of sodium. Zinc plays an important role in the cell-mediated immunity inside our body. So some features of the old age such as delayed wound healing or decreased taste sensitivity or the anorexia, they are also associated with the zinc deficiency. And its deficiency, it can also lead to increased inflammation, which is associated with many health problems, including cancers, heart disease, autoimmune diseases, and diabetes. So therefore, the elderly people, they are shown to be in good zinc balance in spite of having low levels of zinc in their diet. So an estimated average requirement of 14.1 milligrams is suggested for men and around 11 milligram is suggested for the females, and RDA of 17 milligram is suggested for men and 13.2 milligram it is recommended for an elderly woman. It can be taken from lean meat and seafoods. They are good sources. And older people who avoid flesh foods, they may be at increased risk of poor zinc status. So therefore, food grains and other protein-rich plant sources like beans and legumes, they should be consumed to meet the zinc requirements. We have just discussed the requirements of minerals which are of importance during the old age. Now let us focus on the vitamins. We will start first with the fat soluble vitamins. Vitamin A deficiency is rare among the elderly, but elderly, they are at risk if the diet it is low in the animal products or the vegetables and the fruits. According to RDA 2020, for elderly men, EAR of 460 micrograms and RDA of 1000 micrograms of vitamin A is recommended. And among the female, an estimated average requirement of 390 micrograms and RDA of 840 micrograms of vitamin A is recommended. And if we talk about vitamin E, it is helpful in reducing the decline in the cell mediated immunity and it is useful in protection from the DNA damage also. So the diet of the elderly, it should include nuts and oil seeds, and along with some fortified foods to meet the requirements of vitamin A and vitamin E. Vitamin D deficiency, it leads to secondary hyperparathyroidism and insufficient bone calcification and osteomalacia. And all this, they can cause osteoporosis, and it can lead to falls and fractures because of weak bones. Vitamin D, it is utilized by the non-skeletal tissues also. And so the deficiency of vitamin D, it leads to cardiovascular diseases, hypertension, dyslipidemia, insulin resistance, obesity, diabetes, metabolic syndrome, and Alzheimer's disease. So along with taking care of the health of the bones and their strength, vitamin D is needed for other important functions also. And elderly people, they are at risk for vitamin D deficiency due to many reasons. So they could be decreased exposure to sunlight because they are confined to their homes, or because of poor dietary intake of vitamin D containing foods. There could be decrease in vitamin D synthesis by the skin also. So in spite of good sunlight exposure, the body may not be able to convert it to vitamin D, or there could be diminished absorption of vitamin D. There could be decrease in conversion of active form of vitamin D by the kidney, and there could be because of reduction in the vitamin D receptors inside the body. That is why the Indian Council of Medical Research in the latest RDA 2020, they have raised the requirement as compared to the younger adults. So because of prevalence of high amount of vitamin D disorder among the elderly, they have recommended an additional amount of 200 international units, which amounts to be 20 micrograms of vitamin D over 60 years of people in our country. So the RDA of a normal person is 1000 international units. So adding more 200 international units, it amounts to 1200 international units. Though the EAR, estimated average requirement, is same for men and women if they are young adults or the older adults, that is 800 IUs. And dietary supplementation with the calcium and vitamin D, it improves the bone density, and it may prevent the fractures in healthy elderly population of our country. Let's study about water soluble vitamins now. Vitamin B6 deficiency is common amongst the elderly. It is often associated with the protein energy malnutrition, and it contributes to anemia and neurological disorders also. It is responsible for the decreased cell-mediated immunity and reduced lymphocyte proliferation also, which also contributes towards the impairment of immunity. Now, vitamin B6 requirements, they are also increased because of atrophic gastritis, which interferes with the absorption of the vitamin B6. Similarly, liver dysfunction, it is an additional risk factor for the vitamin B6 deficiency. And that is why it is recommended that an estimated average requirement of 1.6 milligram and an RDA of 1.9 milligram has been suggested by Indian Council of Medical Research for the elderlies. Severe deficiency of folic acid in the elderly, it can result in anemia, and it can elevate the serum homocysteine levels, which is a risk factor for the cardiovascular diseases. So vitamin B2, that is riboflavin, folic acid, vitamin B6, that is pyridoxine, and vitamin B12, that is cyanocobalamine. Together, they play an important role in the metabolism of homocysteine. So therefore, it is very important to include folic acid in the diets. The diets which are lacking in the folate. So the consumption of folate-rich foods, it should be encouraged among elderly also. So it is recommended that an estimated average requirement of 250 micrograms and an RDA of 300 micrograms is suggested for men, and for women estimated average requirement of 180 micrograms and an RDA of 200 micrograms has been recommended for the women. In general, the serum level of vitamin B12, it declines with age, as it can lead to anemia, neurological disorders and dementia. So the usual causes of vitamin B12 deficiency are atrophic gastritis, echlorhydria, that is the less production of hydrochloric acid inside the stomach, then strict vegetarianism and bacterial overgrowth, which decrease the absorption of vitamin B12 from the intestines, and it can lead to pernicious anemia. So supplements or the fortified foods, they are needed to meet the recommended dietary allowance of vitamin B12 or the cyanocobalamine, especially in the vegetarians or the vegans. So the vitamin requirements, they remain same as for the usual adult requirements, that is estimated average requirement of 2 micrograms and RDA of 2.2 micrograms of vitamin B12. Vitamin C, it is a potent antioxidant inside the body. It is protective against the stress-related disorders and degenerative diseases like cataract, and geriatric population. They are more prone to vitamin C deficiency, and this can cause scurvy, capillary fragility, and the cataracts. Vitamin C requirements, they are also increased due to stress and the medication, which is quite common in the elderlies. The antioxidant vitamins such as vitamin E, carotenoids, and vitamin C, they have been identified to promote the health of the elderly. Therefore, an estimated average requirement of 65 milligrams and an RDA of 80 milligrams is recommended by ICMR for an old man, and 55 milligrams of EAR and an RDA of 65 milligrams is recommended for a old woman. And it is prudent to encourage the elderly to drink fluids and fruits which are rich in vitamin C, such as nimbu pani or certain juices. Let's summarize what we have studied in this lecture. We had studied about the nutritional needs of the elderly, in which we focused on the recommended dietary allowance of various nutrients, and we studied about the macronutrients first, in which we studied about the requirements and recommendations related to energy, protein, carbohydrates, and fats. And then we studied about micronutrients, in which we focused on different minerals, and after that we studied about vitamins, that is fat soluble vitamins and water soluble vitamins. So we will continue the nutrient needs of water and antioxidants in the next lecture, and we will also study about the dietary recommendations and modifications needed for the elderlies. So this finishes today's lecture. Thank you very much.